So minimizing the likelihood of failed back surgery syndrome is key. You don't want to just go into it blindly and not take certain steps before surgery occurs. So that's dependent on a few different things, and those things revolve around a multidisciplinary approach to the patient's pain before surgery. Patients with failed back surgery syndrome have usually had one or more surgical interventions that have failed to treat the pain. And in this situation, we're talking about surgical interventions. Injections do not count as surgical interventions. The rate or the incidence of failed back surgery syndrome is between 20 to 40%. So let me repeat that. The rate of failed back surgery syndrome is between 20 to 40%. That equates to about somewhere between 1 to 2 out of every 5 patients will have failed back surgery syndrome. Now that's some real data, and I think that's important to sort of spend a minute digesting that. Let that absorb into your mind, because I can tell you for a fact that some of the surgeons in our area, I'm in the Chicago area, and I can tell you for a fact that I've met surgeons who honestly believe 100% of their patients do great after fusion surgery. They honestly believe that their patients have zero failed back surgery syndrome. They honestly believe that it is completely an operator-dependent phenomenon, or that the patients are lying and faking it and are a bunch of drug addicts. Now, raise a hand. How many of you have encountered that sentiment amongst the surgical community? And by the way, I'm not trying to rip on surgeons, but they're not all like this. But so about 50% of the audience has met someone or met a surgeon or met a patient who has been told by a surgeon that, hey, if I do surgery, you will not have any more pain. It's not that simple. I mean, if in the best of hands, okay, we might see maybe a 20% failed back surgery syndrome rate. In the worst of hands, maybe we're going to see 100% failed back surgery syndrome rate. But it's not a 0%. And that's because nature happens. Okay, people do something called healing after surgery. And how do people heal after surgery? I heard it, scar tissue. Right? That's how you heal. You heal by scarring. Now, there are some ways to prevent or minimize the amount of scarring that will occur, and we'll talk about that at the very end. But they heal by scarring. So inherently, you're going to scar and you're going to develop this mass of gumbled up tissue right where the surgery occurred. Now, how do you think that that's going to be painless in 100% of patients? It's possible. So a review of discectomies for lumbar disc herniation in patients under the age of 70 showed that about 36% of those patients ended up with FBSS. FBSS was present in almost 30% of patients in a prospective study where they looked at patients who underwent laminectomies with or without fusion. So again, failed back surgery syndrome is not always for fusions. It can be for minimally invasive things like laminectomies. Anytime the patient's back or their tissues are exposed to air, you're going to develop scarring. That's just how it works. So any of these procedures where you're exposed to that air or that scarring, and especially procedures where there is anatomical change or destruction, if you will, you're going to have some element of scarring. So improved outcomes are completely dependent, as we said before, on the multimodal approach that we use beforehand, as well as the comprehensive approach that the surgeon uses before surgery. And that includes the ability to effectively diagnose, manage, and treat the patients beforehand and afterwards, after they have FBSS.